Chapter 8, the nervous system. First word, cyphalgia. Cephal, head, algia, pain. Cephalalgia, headache. That's it. Nothing too much. And cerebrospinal. Cerebrospinal in most cases is reused together with cerebrospinal fluid. What is this? In the cerebral means the brain. And I mean the big brain, cerebrum. And the brain is connected with brainstem and the spinal cord. The cerebral spinal is the brain and the spine. Inside the brain and the spine, there are fluid flow through to serve as many functions, and a major function of the fluid, not only inside but also outside. The whole brain is also the cerebellum. Yeah. The whole nervous system is enclosed by the cerebral spinal fluid, and then they're inside and outside, they are connected with each other, which means the whole spine and the brain, the central nervous system, are merged or floating in the fluid. They are suspended in the fluid, and this is a good way to protect the central nervous system from the physical impacts of the system. So this we call it cerebral spinal fluid. And the next one, the electroencephalogram. Gram means a figure. Electroencephalon, the head. This is the ECG, I guess. ECG. You may heard of it. EKG. No, is it EKG? ECG? Or I forgot. EKG means the heart electrical activity, and this recording the brain electrical activity, and it's used for many reasons, for diagnosis sometimes, and also it used a lot in the research to identify the human cognitive behavior in the brain. And okay, let's going forward. Cereballitis. Let's say cerebellum. Cerebellum, it means small brain. Where's the small brain? This thing on the back. Cerebellum. So, and cereballitis means the infection of the cerebellum, and normally caused by a virus. So then let's see. Okay, meningitis. I get the new. Let's use this one first. Meningitis is inflammation of the meninges. So what is meninges? Meninges are, each of those brain have 3 layers, a brain and spinal cord. I'll be using the spinal cord here. And this is the brain. And the first layer, full of blood vessels, I will using the red one. This is called the pia matter is closely attached to the brain. And then the second layer, they call it arachnoid layer. And you have cells, not here a layer of cells, and also you have cells standing up to make a cavity. This is called subarachnoid cavity. And then what you can find here, the cerebral spinal fluid you can find here. And above the arachnoid cavity, duromater. The duromater, you may heard of an epidural. That's the injection above the duromater. Is the hardest one. The whole thing called it meningitis. And meningitis means the infection of the meninges. Sometimes may be lethal because it did a huge inflammation that even damaged the brain. Next one. Myelomenincocele. Okay, what is this? This is the most severe form. We call it spina bifida or bifida. I guess some of you know. What does it mean? What do you mean by spinal bifida? Spinal bifida. So we draw this spinal cord. This is a vertebra. In the center, there's a big hole allow the spinal cord to go through. And then if you look in from the side view, it's something like this. And then we draw that one. And then the spinal cord is run through the hole. And then before we say here, there's the disc in the vertebral disc. This is the vertebral bones. And then it runs through is the nerves like this. And okay, these nerves are enclosed by a membrane, so the nerves stay. Not only this whole spine are enclosed by a membrane, so the spine call it neural tube to enclose everything. So where's the membrane? Yeah, that's it. Yes. Where's the memory? The memory is supposed to be green color. Okay, that's one thing I've not wanted. I believe it's here, but you can double check. Okay, there should be a memory. The outer layer memory call it the neural tube, the nerve tube. So in the very early development, this special thing need a special nutrition for it. folic acid to make sure the nerve tubes are closed enough. And how it works is not the discussion here, but that's one of the major reasons why pregnant mommy need a folic acid supplement to make sure that nerve tubes are enclosed properly. However, if for any reason, not only for folic acid deficiency, for any reason, stupid. Some of those sit here, there may be a gap. So it's not closed. But in some cases, if there's only a gap, it's not that big deal. I mean, it's still not good, but not huge deal. So this is called like by the all to yeah, it's only a gap, and for some reason, somehow now it become a little bit worse now. Not only there's a gap of the tube, but also now the meninges getting out. The meninges getting out for herniation, and this is worse. So this is called meningocoelum. Anyway, so this thing, meninge going out, but still not a big deal because it's largely the nerve signal transmission is not affected. However, the most severe form is in this myelomeningocele. Myo means spine. And then in these cases, the nerve in the spine also get out in the hernia, in the sac. And this becomes the worst form of the spina bifida, called myelomeningocele. And in this cases, because nerve are getting out, is really affecting anything below this position of the spinal cord. And like say the legs or other organs below this site may be affected, maybe as bad as paralysis. So this is the most severe form of the spinal bifida, called myelomeningocele. Good. Let's keep moving with this. Yeah. Myelomalacia. Myelo means spine. Malacia means softening spine. And that's it. Not much we say softening spine. And largely due to spinal injury. So, and then next one. Poliomyelitis. And it's largely known polio. It's a nerve injury caused by polio virus. It can be as bad as the very severe paralysis. It's a virus, polio virus, to quickly affect the nerve system, especially the anterior form or the ventral form of the spinal cord. It's the spinal form. I'm trying to draw the cross section of the spinal cord, and this is the one, and in the center, which mentioned here, the central canal, you have the cerebral spinal fluid coming through, and then it's surrounded by the meninges here. we're trying to here drawing this one is trying to say that in the center, the butterfly kind of butterfly shape. This is called the ventral horn, and in the ventral horn you have motor neurons. The neural cells that control the motion called motor neuron, and poliovirus affecting here, and that's why it causes paralysis. We're going to because the paralysis affecting limbs, and so far you not no. But the vaccination of polio works very well. Basically, you can 100% stay protected from the polio virus once you take the polio vaccination. Okay, next one. Anasia. Anasia means the basically you block your pain. You have local anasia, general anasia, but general anesthesia that means the whole you just lost of conscious, the whole body and anesthetized. So anasia, yes, you know the name, right? Anasia, and it's just blocking the pain. And then the thing you use to block pain called anesthetics, chloroform takes anesthetics. Okay, that's it. And then hyperaesthesia means super sensitive to stimuli. And in this case, anasia, if you by the word, it means it's no sensing at all. But in the practical use, it means blocking the pain. But hyperaesthesia means the hypersensitive to things, not only pain, the vision, the sight of vision, hearing, touching, anything, pain, anything you can think of. If it's super sensitive to those things, like I said, the hypersensitive. Okay. We can start a new page because there's a whole bunch of stuff in the next page. In here, there's a lot of things about paralysis and plegia. Paralysis means weak muscles, and plegia means paralysis of the muscles. Weak means, I think you know the name of the difference. Weak means just weak, less strength, and paralysis means you completely cannot walk or move it at all. So hemiparesis or hemiplegia. That means half of the body. Cannot move or have weakness. Normally one side of the body. It's often caused by something wrong with in the brain. Here, the brain has a crossover, so something wrong on the other side of the brain, causing the weakness or paralysis on the other side. So, and then the next one. Quadriplegia or tetraplegia, and that's this is the word thing. Somehow everything beneath the beneath the neck is being damaged. It cannot move. So this is quadril and the tetrad is 4. It means 4 limbs, but not only 4 limbs. Everything beneath here lost. Sometimes even lost senses. Not only cannot move, also lost senses. This one is often caused by the damage of the spinal cord in the neck. Diplegia. Diplegia is the legs. In most cases, the legs are being that cannot move. I don't have to draw every time. Now here, the leg. And sometimes the arm is also affected, but at least less severe than leg. Diplegia, the lower half. Then the mono is only one monoplegia, only one arm or leg, one of those. So that's it for the plegia. What's the next? Synesthesia. Synesthesia, together, same thing. For example, 1, 2, 3, 4, and 1, 2, 3, 4. In most people, just know the number. However, in some people, 1 is green, always green, and 2. Whenever they say 2, they remember red, and whenever they say 3, remember blue, and 4, purple, etc. So this is the otherwise unrelated sensing. For some people, they are just constantly, involuntarily, simultaneously joined together, and this is called synesthesia. It's not a medical condition. It's also an interesting phenomenon. It's also interesting that people have this. About 4% of people, right? Yeah, 4% of people have this one. In most cases, people have this synesthesia, have better than normal memory for some reason. Okay, keep moving. What's next? Neurolysis. Neurolysis is based on this word. Neuro means nervous system. Lysis, dissolve, kill. Something that remove or kill the nerves or neural system. What does it mean? It means that it's a medical procedure. Yeah, it means either it's a physical or chemical way to remove or block the nerves, the sensing pains. Why do so? And I'm trying to. Right. Say this guy has a. Sure. It's interesting. What kind of tumor? It mostly used to in the tumor patients. I know in tumor patients, the liver tumor is very painful, but to be honest, I do not know if neurolysis normally apply to liver cancer. But let's assume it related to liver cancer. The liver cancer is very painful, and this pain is transmitted through some nerves to the brain. This is basically we call it the last resort action. No, yeah, kind of. Last resort action is the fusion of the joints, but this is kind of also very too close to the end of the treatment. So when all the other method of relieving the pain caused by cancer failed, some some surgeons invent this way to either use physical cut or chemical ways to block the nerve that transmit the pain from the cancer to the brain. Use this one to relieve the pain that causes the cancer. That's what we mean. That's why I have this surgical medical treatment, neurolysis. And next one, neurasthenia. This is used to be it's basically has been proved to be wrong. It's not even a disease. People used to believe that, say you're very tired for some reason, you develop some headache, anxiety, etc. After it consume your nerve system too much. And however, it's not the case. It's not even a disease by itself, so it's not used anymore. Let's keep going. Neuroraphy. I'm not sure how to pronounce it. I mean, whenever I have raphy or raphy, it's surgery, or just surgery, close surgery, whatever. So neuroraphy, it means there are multiple nerves coming out, and then you suture them together. When they get together, it probably may increase their chance of getting regenerate much faster than before. They call neuroraphy. But later, I think next chapter we have more about the raphy. I mean, switching up. But some of those are common questions. But this raphy, switching the neuron up, is not a common use of the raphy. In most cases, it's like switching the cut up. But this means switching the nerves together to help them regenerate. And last two things. The nerve cells. In the nerve system, we have mainly two types of cells. Neuron. Neuron are those cells. See within this. Send signals from one side to the other, the neurons. And but in the central nervous system, which means the brain and the spinal cord, neurons are not the only cell. There are also other cells, non-neuron cells. We collectively call them glial cells. And glial cells give the name, since called glue, because at the beginning people thought that the function of the glial cells to glue things together. However, nowadays we know they are not. The glue things together is not their only function. And so here we talk about two cells. One called it astrocytes. Astrocytes means it looks like the star. Astro means star. But astrocytes is the most abundant, probably the most important cells in the nervous system. And what's the function? It's use brain to draw astrocytes. Astrocytes. What's the function of the astrocytes? The astrocytes also here the blood vessel, and in the brain the blood vessel is largely enclosed by a thing called blood-brain barrier, which control the materials getting in and out from the blood. And one of the major functions of the astrocytes is forming this blood-brain barrier. And then since the majority of the blood vessels are enclosed by the astrocytes. The neurons actually do not have direct contact with the blood vessels, and then the blood vessel nutrients first get into the astrocytes, and then get into the neurons. And sometimes even the astrocyte even half digest the nutrients, for example, glucose. In some cases, even glucose are further digested into lactate and then feed to the neurons. That's another important function of the astrocytes. Astrocytes has many functions. We cannot finish everything here. Maybe in future. And then another thing, oligodendrocytes. Oligodendrocytes means this is all. There's a lot of things to so this forming another special myelin sheaths. Myelin sheaths is kind of the electric insulation wrapping of this long shaft. We call it the axon. Axon, you have the neurotransmission from here to here. Without the myelin sheaths, it just go step by step, slow and consume a lot of energy. But with the myelin sheaths, in the future learning, we jump from these places, another places, and faster and consume less energy. And oligodendrocytes that form in the myelin sheaths in the central nervous system. Though both of those are in the central nervous system. Outside the central nervous system, the myelin sheath is not made by oligodendrocytes. They are made by the Schwann cells. So that's it for chapter 8, nervous system. Okay, see you next time.